This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Marcey Rader believes that health powers productivity. She is a multi-certified health and productivity expert, one of 800 certified speaking professionals worldwide, certified virtual presenter, digital wellness practitioner, 3-time author, and creator of the Powered Path Playbook. As the founder of RaderCo, Marcey helps executives, teams, and individuals banish burnout, keep good people, and move forward through practical, tailored tools, healthy, sustainable habits, and coaching accountability. Sought after by startups to Fortune 100 companies, she's spoken for tens of thousands of people on 5 continents. As an award-winning global speaker, she trains her audience to improve their focus, maximize their energy, conquer the calendar, master tasks, and extinguish their email. To change your career, team, or organization one habit at a time, learn more or connect with Marcey at marceyrader.com. That's MarceyRader.com. Today, I am super, super excited to have our guest, Marcey Rader, here on My DPC Story, talking about life from a different perspective. She's not going to be sharing about how she opened her DPC, but she is very, very fond of direct primary care, and I was able to meet her at the DPC Summit last year in Kansas City. So, Marcey, thank you so much for joining us today.
It is my pleasure. I think that is an understatement. I shout from the rooftops that everyone should be, using DPC care, and it should be the way medicine is. So I'm a huge advocate for it.
And we need more of you out there. And so today I wanted to have you on to really share about your expertise and your perspective, because what I love is that, and this is when I heard you speaking at the summit, I was like, oh my goodness, I would love to have you on the podcast, because you not only talk about productivity, but you also talk about one's health. And that mission of yours that's fueling everything you do really has an amazing story behind it. So can you please share with the audience what happened in your own personal life that made you start down your own career path of being a productivity expert and choosing the career you have today?
It was a very crooked path. My degrees are actually in exercise science and exercise physiology, a master's and bachelor's, but I worked in biotech pharma for 14 years in clinical research. And so I traveled 48 weeks a year, moved up into where then I was a trainer and then a training manager. And basically in my 30s, I was such a high achiever and lived such a high intensity lifestyle that I went into menopause at age 36. I triggered Hashimoto's disease, and it started to really affect my marriage. And the final straw was I was in San Diego for almost a month. And my husband, I only got to see him from Friday night late until Sunday morning in that whole month, because I wasn't able to fly home because I was doing a 3-week training or a month. And he, because the time zone, we're in North Carolina, that was, his window. And I saw him exiting from the gate, and the look on his face was just, one, so happy to see me, but also just so tired of the way our life was, and that we were ships passing in the night. And I had also, I'm going to say, suffered from some pretty depressive episodes the year, like 2 to 3 years leading up to that, because my work was so stressful. And it's funny because I thought, because I am the primary earner, I was then, I am now again. My husband is a professional drummer and drum teacher. So his income has always been more like a supplement. And I could have absolutely qualified for mental health leave, and I wouldn't take it because that only paid 60% of my salary. And I thought, how could we live on that? How could I live on 60% of my salary? So I just suffered. And what's funny is when I quit my job, I lived on way less than 60% for like 3 years. And, now I've exceeded that, but it took time for me to get there. And it's funny how when you make a decision and you change your lifestyle a little bit, you can figure it out. And so when I made that decision, I wasn't really sure what I was going to do. I just knew I was going to quit. And I gave myself a timeline of a year. This was in February. I said the end of the year. The next day we were walking on the beach, and it kind of came to me that I should start coaching people on the things that people were asking me to help them on the side. So, I traveled. I also competed in over 100 and ultra endurance events during that time. I did Ironman, stuff like that, which I'm not saying, that is not a badge, because again, triggered menopause and Hushman and all that. It was not a healthy lifestyle. But I shut down with inbox zero every night. And people would say, how do you do that? Tell me how you do that. And I thought I could make a business out of this. Well, I knew nothing about business, nothing. I never sold anything. I never marketed myself, or at least I didn't think that I did, but we all do, right? And so thankfully, if you're familiar with StrengthsFinders, the StrengthsFinders assessment, I am #1 learner. And I'm also maximizer, achiever, and high discipline. Well, that helps. And so I am always, reading business books, taking courses. I hired a coach right away. And I learned that I love the business part of it. I love it. And I'm good at it. And so I initially focused just on travelers because I thought, I know these people. And I became a spokesperson for a national hotel chain. And I had all these successes right away that I didn't know I wasn't supposed to have. I didn't know you're not supposed to be a national spokesperson in your second year in business, but it sure worked out for me. But it wasn't just handed to me. I just kind of went after it, and then it transitioned to really any type of business, and actually moved really far away from travelers because people were saying, well, I want help with my inbox. I want help with my time. I want help with this, but I don't travel. And so it's really morphed. We're celebrating our 10th year this year business. And my business model, I have 10 coaches, a full-time director of marketing and client concierge, a website specialist, and then a content researcher. And I absolutely love my work every single day, every day.
Well, congratulations, because that is amazing. We know that within the first 5 years, lots of businesses will close. And so for you to have surpassed that and to be so successful and to be helping so many people in all aspects of life, it's just incredible. So again, I'm super excited to have you on. Now, I want to point out there that hearing your story, even though, and I mentioned this before we started recording, you are not an MD or DO like most of the people listening to this podcast. However, your story is sure as heck relatable to pretty much everyone who is listening to this podcast. We are so regimented in our training as physicians, and we do this because that's what the rotation requires, or we do this because that's what residency told us to do, and then go do a job because that's what we know is being employed. And so when we talk about people relating to your story, and we talk about people who are like, wait a minute, what am I doing with my job, with my career, with my life choices? And they're at that point of questioning, what am I going to do for the next 10 years, 20 years, 30 years? What is going to make me happy? I want to go back to your talk in Kansas City, because you have this huge picture on the screen with a guardrail. Instead of boundaries, you call them guardrails. And so I want to ask, when a person is in that position of, like you were, just what am I doing, at a level of burnout that we experience all the time in medicine, especially in employed medicine, how do you challenge people to think about their guardrails when they're considering transitioning to a different career path?
Yes. So I want to explain first why I use the term guardrails. People don't like barriers. They don't want to, they say, I don't want to put a barrier between me and my clients or me and my patient, because it feels very inaccessible. It feels very rigid, and it feels just strong, but not in a good way. Guardrails keep us safe. When I am driving around the Blue Ridge Parkway, I want guardrails there. So I don't, if I swerve, I'm not, driving off the mountain. And so if we think about guardrails keeping us safe, they're keeping our time, our attention, our focus, our relationships safe, and also keeping patients safe. Because if we are distracted while we're with them, we may make a bad choice. If we are distracted when we're with them, then, it's very easy to accidentally check the wrong box on your iPad. And so creating those guardrails are important. Tech guardrails, I don't really use the term work-life balance, except when I have to, because that's a big search term and people know what I mean by that. But it really comes down to tech life balance and managing our technology. And when you are starting a new practice, or even if you're just in it, if you're already in it, then you have to do retraining, of course. But if you're starting, decide what your guardrails are going to be. Are you going to be available after hours? And if you are, what are those channels that people must use? Email for this, text for this. If you say, only text me for an emergency, and somebody texts you and says, I need my prescription for metformin filled, it's going to run out in 2 weeks. Well, that is not an emergency, of course. But if you respond to that, then you have now trained them. You can text me for anything, even non-emergencies. So it really comes down to communication expectations and making sure that those are everywhere. So on our website, we have an email manifesto. And when clients sign up with us, they get a next steps email and they get a link to the email manifesto. And we say, urgent items that need addressed within 24 hours, please text Marcey at whatever, the number. For everything else, we respond per this email manifesto. Now, ours would be different. There's never a productivity emergency, but I could be speaking somewhere and maybe, the venue's changed, like almost happened at DPC Summit, but, making it very clear. My doctor, who is very humble and doesn't like me to brag on her, but I do it anyway, Dr. Amy Walsh, she does a really great job. It is everywhere in all of her emails, and she repeats it over and over and over again. Email for this, text for this, phone for this. And of course, not everybody follows, the guidelines. But even if a percentage of that does, then that can be a game changer for you. And one other thing that I want to point out when you have a team is that if you send messages during off hours, weekends, nights, whenever your off hours are, it does not matter how many times you say, I work on the weekends, I work at night, but I don't expect you to respond. If you are in a position of hierarchy, which medical doctor, you are a hierarchy, people will feel compelled to respond. They will feel compelled to respond. And so it's better to send, schedule to send those messages. And that is the easiest way that you can create these tech guardrails, is to schedule your messages to send at just during working hours. If you work off hours, fine. I work off hours sometimes too, but an email or a message never goes out unless they're within the office hours, because I don't want to train people that that's how I work.
It's so important. And I think that idea of tech guardrails in particular is helpful for anybody along their DPC journey, whether they're just starting out or whether they've been in practice for 5 years. It's really important. And, when we talk to people who have not necessarily created and followed guardrails, it gets pretty painful sometimes to hear the stories of, oh, this patient now is a high utilizer because they blah, 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 text it, whatever. And so it is really, really powerful advice, and advice that can really create the practice that you want it to be, designed around your lifestyle and what you wish to accomplish with each and every day. So thank you for that. Now, I also have to put a shout out here because I'm like drinking from my DPC story mug, because Dr. Amy Walsh is my secret Santa. So I have to say thank you to her for that. That was awesome. She also got me a Big Trees MD mug. So I just go between the two mugs. But yeah, so I wanted to ask now, when it comes to DPC, like you said, it's an understatement to say that you're a supportive DPC. But when people are transitioning to DPC, they're opening their own clinics, they're in that same place you were. They've never been a business person, they've never marketed themselves, and it comes to the quote unquote elevator pitch. You were a speaker for Upward Women, talking specifically about a memorable elevator introduction. And so when you pull from your experience in elevator pitches, and you think of the world that you've been exposed to with direct primary care, and think about your life as a patient, as a person who appreciates the direct primary care movement, what are the value propositions that you've heard from being a patient as well as being around the DPC space that really would, in your mind, be powerful for people to include in their elevator pitches, no matter who they're talking to?
Oh, that's a great question. And we actually had a new DPC doc at that workshop that I co-hosted. Clear, not clever. When people are trying to be clever, the person on the receiving end can feel patronized, or if there's no clarity, then they walk away and they're not going to remember you, except for maybe that that they weren't sure what you meant. Getting right to the point of what you do and who you serve and how you serve is much better than trying to be clever about it. As a consumer, it is very hard to understand that this is not some kind of pie in the sky voodoo, magic dust stuff that, how does this even exist? Like, how have I not heard about this before? And I think having just maybe 2 statistics on how many DPC docs there are or how many clients are served could be helpful. I wouldn't give more than 2. This is how many DPC practices there are. This is, these are the benefits. But thinking about, what can I tell someone in 30 seconds or less? If they are interested, then they'll say, tell me more. And then you can give them everything. Because the biggest mistake people make is showering with information too much, too fast, too soon. And then people say, oh, that's nice. And then they just walk away and their head's swimming. But getting it down to 30 seconds or less, and then wait for them to say, tell me more. And have an email template. So I have what I call a referral template. This is actually the meeting that I'm co-hosting next week about networking with impact. And so one of the things that I have for me personally and for RaderCo is an email template that I send out to anybody that I think might refer to me. And I say, if they're interested in Marcey as a speaker, if they're interested in Marcey as a training company, if they're interested in Marcey as a referral partner, coach, whatever that is. So it's 4 slightly different paragraphs. If you have something like that you can send out when somebody, you meet a great referral partner, or you have a client that's, an advocate for you, you could have, to introduce me as a primary care doc. to introduce me as a potential partner, to introduce me as a speaker on DPC, then that way, when you meet somebody like me who wants to promote you, then you have made it easy for them. And you don't want them to write their own paragraph because they might not get it right. They can add stuff to it. They can add like, she's amazing, and blah, blah, whatever. But giving people a template, you just want to make it easy for them. And every time I have ever sent somebody my referral template, they're like, wow, this is so helpful. And I say, just save it. And I'll ask people, send me yours. And then I am much more likely, like if I met somebody at a conference and they lived where you live, then it'd be much faster for me if I already had your template saved, that I could be like, oh, here's the, introduce so-and-so to so. Then if I had to like, oh, I need to remember to write this intro and send it out.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. That's such a huge tip. And for those people who are listening and saying, well, how do I create a template? If you have a Gmail account, you can do templates free completely in the email composition area. So, you can Google how to do that, but you can create your own templates and you can save your templates and then you can send those out. You can share those templates with teams. That's what we do at my practice, because this is something that I think about from what you said at the DPC Summit all the time. Is, if somebody keeps asking you the questions, create a video, or if somebody keeps asking you the questions, create a template or something. So you have what you are going to share with every single person who asks that same question already in a dot phrase or a video or whatever. So I think that is super, super helpful. You have your own podcast, Health Powered Productivity with Marcey Rader, and you focus a lot on keeping people in their zone of genius. And so the tasks that do not need to be requiring your level of training or your level of expertise or whatever, you can automate those things or hire somebody else who is not you to do those things. So when a person is in their DPC, they've done their elevator pitch, they've opened their doors, and they're thinking about, the tech guardrails that you mentioned earlier. How do you suggest people reevaluate their guardrails periodically throughout, the months, throughout the years, so that they are making sure that those guardrails still serve their purpose in life?
That's a great question. One thing I would do is start with the end in mind. If you desire to not work Fridays or not work in front of people, on Fridays, like maybe that's when you do office work, but you're like, I don't want to see people on Fridays. I want to end at 3 on Wednesdays. I want, only phone hours on these 2 days or something. Start right from the beginning, because it is harder to retrain people than to just train them from the start. Every year, at the end of the year, I look at my calendar, I look at how much time I'm allotting to different things, and I am reflecting and then prioritizing and changing it up based on that. Just this year, 2023, I looked at my calendar and I coached 3 days a week, and I was coaching from 10 to 4:30. And I realized last year, like that extra half hour, I was already tired because I'm a very early morning person. So a lot of times I'm already up working at like 7 or something. And so I cut it to 4, from 10 to 4 p.m. And so really looking, and as your practice is growing and more people are taking on work for you to, reevaluate your tasks continually, but also how you're batching your time. Because what may feel like, oh, I can do this. Like, me saying this to doctors may make more sense than me saying this to other people. But coaching, I can only coach so many people in a day because I'm just tired. I can do other things, but I only want to coach so many people. So it could be that, you start out with, I can treat this many people in a day, but then you realize, okay, with all the other business stuff that I have to do, I actually can't. It's too much. So, making sure that you're always evaluating that is important.
I'm laughing over here because you asked something at the DVC Summit. You're like, who in the audience has done a million things during the day and has no idea what they actually got done? And my hand shot up in the corner of the room because I was like, oh, that's me most days, I feel. Yeah. So yeah, I love that. I love being able to be in DVC and own your schedule and own what you're going to do. That equals how many patients you're willing to take, how many people you're able to take care of without losing quality, which is what we find too often in fee-for-service. Mm-hmm. And also being able to say like, yeah, one of those tech barriers is, like you said, this is how we correspond if you're wanting a refill or whatever. And then from that, being able to say, okay, and now the things that I really want to do, self-care, exercise, go to, your kids' performances or whatever, be a field trip driver. All of those things can be planned out if you're thinking, like you said, from the end, moving backwards, rather than being reactive to everything that's going on, because that is definitely something that, as an entrepreneur, you learn very quickly, like the idea that, oh, if I had designed this workflow this way, it would get me to my end goal faster or smoother. So I love that.
Yeah. And I would imagine that doctors are also, it's a little bit like, it's a perception, the same that I get. If somebody sees me doing something that's wouldn't be considered the most productive or the most healthy, it's like they want to call me out on it. Either that, or they're like, oh, thank God she's not perfect or whatever. But doctors are held to a pedestal for things like that as well. And I don't want my doctor to be unhealthy and not have time to exercise and not take care of their health and eat every lunch in front of a screen. That's part of the reason why I was attracted to Dr. Direct, was because they are very healthy doctors in real life. That is what attracts me. And I want my doctor to be that way. And if my doctor is somebody that is, burning the candle at both ends and not sleeping and driving through the Chick-fil-A and it's just, you design your life how you want it to be and your health. You might not be able to be there, like the first year, but that's the goal. At least you have that end in mind and you can work towards that.
Something that you've said in the past is that small steps create a big impact.
Oh, yeah.
And so when we think about what you've just shared and taking small steps to make that impact and to live the life that you dream of, what is one takeaway that somebody could do for this week in terms of taking ownership of this week to make next week better?
An easy change, I'll go back to technology, is to turn off as many notifications as you can. Notifications are on as the default, not to help us be more productive. They are on to get us to use the tool or the app more. That's the only reason why. We have just been conditioned that every ring, ping, buzz, that we're supposed to get those, and that, that it helps us. But all it does is it makes us more reactive and more distracted. And you have stuff coming at you all the time. A nurse comes in and you're on your iPad and you have the patient and the phone's ringing and everything. I'm still surprised at how many people have, like, the Amazon banner will come across that there's something on sale at Target, and then there's breaking news that's never really breaking. And the Weather Channel, predicts rain in 4 hours or something. And they have all these apps coming up. But then even email is not urgent. I bet most people listening, if not all, do not have to be reminded to check their email. You don't have to be reminded to go into your inbox. You know you are going to go in there at some point. So you don't need a message coming through every time. Yeah.
It's so important. And for those people who have iPhones, maybe a couple updates back, they had put a tip about focus mode. And I was like, what is this focus mode? You can select people and you can select applications that can come through on your focus mode, work mode, sleep mode, do not disturb mode. And so like I have my husband and I have my line for my patients, and everything else is turned off between the hours of 8 and 5. And, if somebody does try something like that and they turn off notifications, no matter how they do it, you will feel so amazing next week, even tomorrow, heck, because I think about, like, I was born in the 80s and we did not have the bombardment of like we do these days. And so it's such a quick and easy, low hanging fruit type of strategy to put into place. So thank you for that. Now, Marcey, if people have loved hearing what you've shared and they find it super useful, one, I want to draw attention again to Health Powered Productivity with Marcey Rader. Find it on all major podcast platforms, but also, Marcey, where else can people find you if they wish to connect after this podcast?
Hello, RaderCo.com. Just like it sounds, hello, HELLO, RADERCO.com. I am also LinkedIn only. That's another tech guardrail that I have. I am not on any other social media channel, well, YouTube, and that is by design. It's not like I'm just a voyeur on there. I do not even have accounts. LinkedIn is my preferred. And that's a bonus tip, I guess I would say too, is be very thoughtful about how you choose to market yourself. And if you want to be on certain channels, it is not a requirement for you to be on TikTok, Instagram, Facebook, LinkedIn, YouTube, all of those things. It is not. And the trend is to go deep and narrow now instead of spray and play. And my clients are mostly on LinkedIn, so that's where I hang out, and I'm really able to have focused engagement. If you think you're going to be more of a Facebook or an Instagram or whatever, pick one or two at the most and just use that, because otherwise you're just going to be spread so thin that it's going to feel like too much.
Additionally, you can find Marcey's contact information in the show notes. And for the listeners, she has an incredible book, Work Well, Play More, Productive, Clutter-Free, Healthy Living, One Step at a Time. So a book that many of the listeners can relate to and benefit from. So if you go to HelloRaderCo.com/gift, you can get a sneak peek of that book as well. So go to the show notes, go to HelloRaderCo.com. And thank you so much, Marcey, for joining us today.
My pleasure.
Next season is almost here, so in the meantime, check out the previous episodes, share the podcast with a physician you may know who needs to hear about DPC, check out what's going on dpcnews.com, and until next season, this is Marielle Conception.